Hello friends, I am Dr Madhav Dharme, consultant physician and diabetologist. On this World Heart Day on 29th September, we have with us cardiologist Dr Bhushan Bari.
Hello friends.
As all of us might be knowing that the incidence of heart diseases is growing up in India at a very high pace. To show some more light on this topic, let's ask some questions to our cardiologist Dr Bhushan. Namaste sir.
Namaste.
What can be the causes behind this rise in number of cardiac disease patients in India?
So as we all know that in India we account for nearly 60% of the global heart burden, which is not a very proud distinction to be
Absolutely.
shown off. The main reasons behind these are we as Indians and Asians are more prone genetically for early onset of heart diseases than the Western population. There are multiple factors which are responsible in addition to the genetic factors like lifestyle, diet. We have adopted all the wrong dietary practices. We have the stress level of the younger population has increased, especially after COVID and especially after this work from home. The sedentary lifestyle has become even more common. So these are the usual suspects that we can think of.
Think of, yes. As you said that the sedentary lifestyle coupled with the genetic risk factors of Indians and Asians has increased the numbers of cardiac disease patients. So, can you little bit elaborate more on this lifestyle management? Because as we all know, even if we are genetically prone, but certain lifestyle changes can at least nullify some of the risk factors, because genes, as we know, genetics we can't change, but can we nullify the risk factor by adding up some lifestyle changes?
Yes, definitely. We can't nullify or we can't modify the genetic risk, definitely. But we can obviously follow lifestyle changes. So, to think of the lifestyle changes, we should include a proper exercise regime, which should consist of at least 30 to 45 minutes of exercise, which should be moderate intensity, not a stroll, not just a stroll. It should be either moderate intensity in the form of brisk walking, cycling, jogging, swimming. These are the moderate intensity exercises which can definitely help you, and one should follow these exercises at least 30 to 45 minutes a day, minimum 5 days a week. This is the benchmark of having a moderate physical activity. In addition to that, we should also make changes in our diet, like by including fruits and vegetables, by avoiding red meats, by reducing the salt intake in diet. As we all know, salt is one of the silent killers, because we don't realize the amount of salt which we are consuming. Most of our foods, or especially the packaged foods, they contain lot of salts because they are in the form of preservatives. And the diet should also contains nuts, more raw vegetables, and it should be devoid of red meat. Lean meats like chicken and fish is okay. The protein content should be higher, and the carbohydrate content should be lowered as much as possible. So if we follow these lifestyle dietary changes, we can hope of at least curbing the incidence of heart diseases. Also, I would like to emphasize that even if the person is lean and thin, that still doesn't mean that he is not at risk of heart disease, because there is something called as a visceral fat.
Absolutely.
So the visceral fat is also one of the bigger culprits. So by focusing on these changes, we can hope for blunting the response to the heart problems which can happen suddenly. I would also like to emphasize that the heart diseases or the heart attacks which happen in young patients, they tend to be more deadly than the elderly population. One of the reason behind that is because of the ischemic preconditioning, because the young patients, their hearts are not as used to handling the lack of blood supply as the older patients. So, they tend to have more arrhythmias and sudden cardiac deaths.
Yes. As you mentioned in between the risk involved along with COVID, no medical talk or no health related talk is complete without talking about COVID, which all of us have gone through. And as doctors, we all have faced all those problems, and we have learned through COVID about different aspects of these type of viral infections which can cause heart diseases. What was your experience during the COVID pandemic about heart diseases? How was the COVID linked with heart diseases?
So, as there is no direct link as such which was established, but as we in severe COVID cases which had respiratory distress and all those things, we could see lot of thrombotic complications.
During your talk, you just mentioned about the COVID and its relation with the heart diseases. We all have gone through this pandemic, and as doctors, we have faced many challenges during the treatment of COVID. What was
Yes.
your experience about this link between COVID and heart diseases?
Yeah, so there was a definite increase in the incidence of heart attacks and thrombotic complications due to COVID, because as we all know, it leads to a lot of vascular inflammation, and which leads to thrombotic complications in the form of pulmonary embolism and peripheral artery disease. So, that was the same thing which was linked to premature heart attacks due to COVID or immediate post-COVID period. I would also like to ask you, Dr. Madhav, what was your experience, because you have been treating COVID day in and day out,
Yes, yes.
regarding severe COVID cases and their impact on the heart problems or vice versa.
Yes, definitely. We had a lot of chunk of COVID patients. Some of them were getting well within home quarantine. Some of them were hospitalized, and some went on even ventilator and very critical. And as we all know that some of the patients who succumbed to the illness, and what the major thing which we noticed, that the complications which were occurring because of the prothrombotic state, not only in the heart but it was widespread in the different organs also,
Mm.
like resulting into peripheral arterial disease, and many of them had pulmonary embolism, and it was probably overall prothrombotic state triggered by the inflammatory process which was happening because of the COVID infection. So, and many times the main culprit for that worsening of the patient was because of thrombotic episodes.
Okay.
So, definitely there was a link between COVID and uh, ischemic heart diseases.
Yeah. So, and as we all know, diabetes being one of the major risk factors for heart diseases, and especially early onset heart diseases, more severe form. So, being a diabetologist, and we India now is becoming next diabetic capital of the world. What would you suggest to your diabetic patients so that in future they can prevent or they can minimize their heart complications?
Yes, definitely. Diabetes is one of the biggest culprits for resulting into the heart diseases. And as you initially quoted, the lifestyle changes, the high calorie diet, lack of exercise, on the same line, they develop into the diabetes like diseases, which eventually turn into the heart diseases. So, after all, the overall spectrum of this disease known as metabolic syndrome, which includes diabetes,
Yes.
overweight status, obesity, and then landing into cardiac complications. So, diabetes is definitely a cause behind all these things. So, as far as prevention is considered, my advice always to my patients is to reduce their calorie diet, reduce carbohydrates, indulge in physical activities as much as possible, and be active throughout the day.
And will you recommend your diabetic patients any periodic heart checkups or exercise testing, so that we
Yes,
can
correct.
detect the complications early?
Earlier. Yeah, majority of the complications can be avoided by awareness itself, and many times the patient doesn't know that he has got into the diabetic status. So periodic health checkups to rule out rising in blood sugar levels as well as blood pressure levels, which are equally responsible. The regular checkup is utmost important so that we can catch the disease early while it is not into the full blown form, and we can reverse the things
Definitely.
also. What is your take on similar line? What is your take on cardiac diseases? What test do you advise to the patients to detect the cardiac disease at an earlier stage or at an earlier age?
Okay. So, as we all know, there we one should have a routine screening of for heart diseases, like a baseline basic ECG, 2D echo, and your functional capacity should be tested in the form of exercise testing or a stress test.
Absolutely.
And so above the age of 40, we usually recommend that they should undergo these tests periodically. Along with that, some blood investigations like lipid profile, HbA1c, and some vascular markers like high sensitivity CRP and
Absolutely.
homocysteine levels. So if we can, and also to add, there are the recent this thing is about vitamin B12 and deficiency, vitamin D deficiency. So if
Yes.
this they can be corrected, and collectively we can keep everything under control, we can definitely detect the heart diseases early.
Early disease.
And also I would like to add, for the benefit of general population, that whenever you feel some trouble, some discomfort, some chest pain, just get a basic ECG done. It's a very cost effective and easily available investigation in any part of the country, but that will definitely avoid delaying the treatment, and timely treatment will help in the long term outcome.
Yes, absolutely. So, in nutshell, I would like to summarize this as uh, prepare early, then avoid the diseases, keep checking, and if at all you find any doubt about your health, get tested.
Yes,
So, this should
because
be our motive on this Dil Ki Baat, which
yeah,
we
yeah,
are doing on this World Heart Day.
yeah. So don't be in denial, because no one is immune to heart diseases.
Okay.
Even if we say I am a marathoner, I run 20 kilometers a day, I am not going to get a heart attack. No, that's not the case. We can't predict who will have a heart attack. We have seen people who have had a stress test 1 week back, and then they'll end up with heart attacks, because those are different kind of subsets. They
Possible
get thrombotic
complications.
sudden complications, and then end up with heart attack. So being denial is the worst thing one can do to yourself. So get yourself tested in at a slightest doubt, and get it sorted.
Yes.
Thank you.
So, thank you for this lucid and informative talk, Dr. Bhushan Bari.